the meniscectomy. So next step is tibia sizing. So to evaluate check the size of tibia, the first stop case, use a retractor and check the medial border of the tibia tray, and put this tibia tray on the tibia cutting plane and make sure the medial edge of this template, tibia template, and the bone cortex. The ideally is the same place, same level in the medial side should be flush, but or not, or a slightly overhang, but never underhang. So according to the operation manual, up to 2 millimeters of overhanging can be accepted because the underhang can cause subsidence because a lack of the cortical support. So, and this is the medial side, so the just same size or a little bit overhanging. Next, using the T-bar, the handle, and catch the posterior cortex and push template posteriorly. Then the posterior surface will be flush. So regarding the posterior side, underhanging or overhanging are not allowed because underhanging can cause subsidence and overhanging can very close the keel to the posterior cortex. That can increases the tibial fracture risk, and sometimes during the tissue cutting or the keel preparation, sometimes that can break the posterior cortex. Then put in the template and the female component. The evaluate the flexion gap. This position should be the parallel to the peg. You understand? Then we can keep the same flexion gap. But it is not that inflection 19 degrees on the flexion, but a little bit more flex because this peg hole is around 10 degrees inflection. You understand? You understand? The peg hole is 10 degrees inflection, referred to the femoral anatomical axis. Because using the a linkage device, the tibial component aligned 9 millimeter in bulbous and 10 degrees inflection. So this angle should be 100 degrees inflection because then plus 7 degrees. Because 7 degrees implies it means the posterior slope against the tibial axis, and this hole is peg hole is 10 degrees inflection. Then leg should be 10 degrees inflection and 7 degrees inflection. So theoretically, it should be a 7 degrees inflection to make the parallel to the peg hole and the tibial cutting plane. Then, in this situation, we can keep the same flexion here. Otherwise, so smaller than the 107 degrees, if you made more, 1 millimeter or 2 millimeter more, flexion gap can expand, extend, enlarge, or 107 degrees or deeper flexion. So if we need more, this are end of the femur, the flexion gap can shorten. So it is a very important point. So the cutting surface of the tibia should be parallel to the pegboard. Otherwise, the flexion gap cannot be stabilized. So we are in the confusion otherwise. So anyway, it's very important. In another topic is leg hand position is considered to act as the leg structure due to the gravity. But in some cases, leg hanging position is make the leg like this. So in such case, we should apply a slightly barbell pose to expand and restore the MCL length and range. In the natural hanging, in some patients, MCL is already shrink. Or maybe I don't know the reason, but maybe to the gravity and leg position relationship. Sometimes in some legs apply the beta stress, sometimes the leg gravity acts as a virus and something on the virus. So to checking, the gently lift up the heel and apply the slightly virus stress, but never force the push here. Just only that light raise the patient here. Then, once the MCL length is restored, after that, the thigh can rotate. If you grasp here and push here, so you should make a stress. So not stress, but you should restore that or that MCL tension. It's very important. So breaks a little bit around 110 degrees, accurately saying, so 107 degrees, and upright lift up the patient here and make enough space, and then evaluate the using the feeler gauge. Ideally, for example, number 3 feeler gauge is very smooth and sometimes feel a little bit loose. But once you change the 4 feeler gauge, it is too tight. That is the idea. In most patients, most male patients, the male patient have the very stiff, very tight soft tissue. So we can feel this feeling. 3 is too loose, but 4 is too tight. But the patient with very small frame, the female patient, it is unclear. 3 okay for a little bit slightly tight, but it can be. But 5 is also slightly tight. But because the elasticity of the male patient, and because of the elasticity is bigger in the male patient, especially for the elderly patient. So the ligament can stretch. So in this situation, I prefer to select the looser one because to make the too tight gap, the MCL can stretch, overstretch, and that can cause pathological or chronic MCL damage due to the continuous overstretch and overcorrection of the leg line. So that can cause the lateral side osteoarthritis. But to lose also, of course, can cause the dislocation. So it is a very difficult to identify, especially for the male patients. So, but if you select the tighter one or looser one, I recommend to select the looser one. Anyway, so extension gap is more difficult to identify because in this flexion angle should be around the 20 degrees in flexion, because in full extension, the posterior cuffs can stretch. So in this full extension position, theoretically, the flexion extension gap can be underestimated. And the friction, so in the evaluation, the extension is fully then down the heel up to 20 degrees in flexion and apply a mild valgus stress. The valgus stress is also difficult. If it is too much, the medial gap can enlarge. So before the operation, you should check the endpoint. Before the surgery, if you apply the valgus stress, you can feel the endpoint. That feeling, it should be restore the intraoperatively in the same situation, in the same angle. You should feel the endpoint again, keeping this point and using the field again, then evaluate the extension gap. But we've got only 2 hands. We need 3 hands. Heel and push the knee and insert the field again. It's quite difficult. So sometimes only 1 hand you can apply the enough valgus stress, and using the opposite hand using this one. But sometimes it's difficult. So operator use 2 hands using the heel and knee, and operator and assistant with evaluate the gap, or so ask the assistant to push the knee laterally and then operator use this one. So it is a very, very important step. But I recommend extension should be slightly tight. It's better because there are 2 reasons. Because most dislocation cause in extension and unloaded position. If the extension gap is too loose, friction will occur for example, in the rolling over on the bed. In this situation, is unloaded position. In this situation, the extension gap can enlarge, then turn over, and maybe medial side slightly stretched and opened. In this situation, unloaded condition in extend. So bearing can dislocate. So extend gap can be accepted to be a little bit tight. Because in the normal knee, in the 20 degrees slightly relaxed, but after full extension, every ligaments around the knee can tighten a little bit. So because in the extension position, knee should be very stabilized due to due for the full weight bearing. Such in this situation, the knee should be very stable. But in the flexion, the knee should be a little bit flexible, because to allow the rotation a little bit better than valgus stress. Okay, so this is the key point of this operation, because the gap evaluation decides everything. So it also decides the post-operative later like it. So to evaluation is very important. Okay. Please go to round. It depends on my this talk. はい、じゃあ、次ください。このデバイスのうん。ICC とよくわかんない。ICC っていうのは、インタークラスコーリレーション言うて、要するに同じもんを2回測って、一度確認する。うん、一度確認する。で、簡単な話。10個選んで、そこに1回目、2回目、計測値を測ります。で、同じ人が測ります。同じセットを別の人を測ります。で、これが賢者ない誤差。これが賢者看護差。で、これが大体、もう、そこの ICC の出し方っていうのはあれがあるわ。計算式っていうか、もうチャートがあるから、それにのっとってやったらいいから、それだけやったらいいわ。誰かもう手伝ってくれんやったら、ここだけ、誰か他の人にちょっとこれ測ってという計測でやったらいいし。
この症例、どの250例、
いやいや、全部じゃなくて、
どの症例選んできた
だからもうランダムに、まあ10例か20例。うん。
どの症例を選んだかって。
もうランダムにセレクテッド。We selected randomly selected 10 cases or 20 cases.
2021年から、2月から2020年。いや、
だから、対象になったのがあったでしょ。
僕、この元データちょっともらってなくて。
何が
このなんか、
そう
選んで。
そうか。渡しなかったっけでもそこ俺書いてなかったっけ ?ICT とか。これがそうやからな。
これ書いてたら、じゃあ別にもうこれも修正しなくても。
だから、ここに書いてますよっていう。それでやってもらってね。それを前、このシリーズで測ったの何回もこれを使ってやってるからな。うん。